And so thank you so much for everybody for sharing. I know that, we do meet on a monthly basis, and I really liked hearing everybody's resolutions and goals for 2023. I think it's very important. We forget, that ourselves, because we're helping, others, and, first help yourself and then you'll be able to help others. So thank you. Beautiful. I'm going to go ahead and share our agenda. So then we're right on track. We'll go ahead and we have California Breastfeeding Summit 2023. Is there anybody here? You can go ahead and go off mute if you have, or say in the chat if you guys have already registered for the California Breastfeeding Summit.
I have. This is Lupe. I'm looking forward to those 3 days. The
Awesome.
agenda is packed, so hopefully it'll be good.
I'll be attending to all the 3 days. Yes.
Fantastic. And so are the PCs, right?
Yeah.
That's
All the
amazing.
PCs are, yeah.
Anybody else attending the California Breastfeeding Coalition? I mean, Summit?
Summit, yeah.
Are they giving CEUs? Do you know?
Yeah.
They are, yes, they were giving, what is it called? I had it written down here. CMEs?
CMEs.
Yes.
Is there a cost?
No, I think it's included in the registration. There's not a separate cost.
Mhm.
Yeah. Why don't you send that to me? I'll drop, well, you have my email, but I know that nurses here in the programs that I mentioned earlier would probably, if they haven't already registered, but I do want to give them that information. They're often looking for CEUs as well. So what a great opportunity. They can do both, learn more about breastfeeding and all the great things everyone's doing. So thank you.
Yes. Thank you, Imelda. I will send out an email to with the links of the California Breastfeeding Summit website. So it tells you what their agenda looks like, how to register, all that good stuff, who is a sponsor, current, so I will send you all this. And then I'm so sorry, I saw that we have somebody from Kern Family Systems, Bernardo.
That's me.
Hello. So sorry we did introductions, but could you please introduce yourself?
Yeah.
Introduce yourself and also say a resolution, either a personal or professional.
Oh, nice. So welcome everybody. My name is Bernardo, one of the health educators here at Kern Family Healthcare. I'm actually substituting for Banya. She's one of our new health education specialists, who's gonna take over me being here. So Banya is gonna be our new breastfeeding coalition liaison. So she'll keep us updated. She'll keep y'all updated of anything that's happening in the plan related to breastfeeding. But one of my new resolutions is to be more proactive versus reactive, and that's my plus of the new year. And then what I left, I'm hoping I left some pounds back there. So that's a positive. Cool. Did I miss anything? You're on mute. There we go.
Yes. No, you got it. Yeah,
Mhm.
I think we're all on the same board with you. We want to improve ourselves, and if we lose those pounds, let's leave them in 2023 moving forward to 2024.
Yeah.
So thank you so much, Bernardo. So our agenda does say the next, we did mention, Bernardo, are you or anybody in your staff, are they going to the California Breastfeeding Summit?
Yeah, that's right now we're in the process of trying to get it approved. So if everything goes well, Banya will be attending. Banya, maybe just Banya or Banya and Floyd, our supervisor, should be attending, but we're trying to get that approved right now, going up the chain of command here.
Nice. Nice, nice, nice. Anybody else on here? Brenda, are you or any of your staff members attending the breastfeeding summit?
Let me look at that. What was the dates again? I
It
can't
was the
remember if I looked.
It was the 24th through the 26th.
6th.
Can you guys see my screen right now?
Yes,
Is it showing California Breastfeeding Coalition
yes.
Summit? Okay, perfect. So yeah, I will send you guys over this link in case that you would like to register, would like to know more about it, what they're offering. I'll send you this link. Other than that, does anybody else have any other questions? Can we move forward from thumbs up? Good to go?
Yes.
Cool. Okay, so the next one on the list was the KCBC breastfeeding resource guide. But before I actually dive into that, I would like to show you the updates that I have been making to our coalition website. Can we see the Kern County Breastfeeding Coalition website? It should have like pictures, like a gallery of pictures moving. Can you guys see my screen?
Yes, it looks great.
Okay, perfect. So thank you. A little changes that we've made is that we've incorporated the Instagram to be accessible on the website, but it looks like we're gonna have to pay a membership to actually, for those that don't have Instagram, you won't be able to access it unless we pay for that subscription that will allow us to have our anybody viewing it to be able to view it without it directing you to Instagram. Does that make sense? So if you don't have an Instagram, then you won't be able to see the actual post, which is unfortunate because before it was free, now it's not.
How much is that? How much does it cost to do that?
I believe they have different settings. So it would be starting out, I think, $14.99 a year, something like that. I can definitely, I mean, I know right now we don't have a budget for it, so maybe in the future, but I just wanted to give you guys a heads up on that.
So it's $15 a year or a month?
And that's I would have to double check on that because they had like two different. It's through social feed, and you can create things free, sign up for free, but then they have a certain package deals. But it's not a huge dilemma. It's just I just want to let you guys know if you have any participants that don't have Instagram, they won't be able to access it. But you can always go to our I feel like our website does sufficient in giving the information for now. I also do want to mention that I have added breastfeeding videos. So we still have the COVID breastfeeding information and links. And then at the bottom, we have breastfeeding videos from First Droplets in English and in Spanish. And the whole website can be translated to Spanish as well.
It looks amazing.
Yeah, it looks really good. Can you send me that information of prices? You said there were 2 levels or 2 tiers or whatever. Or
Yeah, I'll go on
send that to me.
I'll send you that.
Thank you.
And also the local breastfeeding support. So this is where I dive into our programs and kind of give a little description of what each business or organization does. And I highlight specifics. And then it's a link to their website. I have La Leche League International. Right now, we don't have any local La Leche League leaders. But once we do, then I can update that. And then at the bottom, we have East Kern breastfeeding support groups. So I know I spoke to Lori Ochoa and she mentioned that she's going to be starting her private practice. So once she gets that going, we'll add her to the website. And then also we have prenatal postpartum support. We have Black Infant Health, Bakersfield Pregnancy Center, prenatal outreach program. The nurse family, yes, partnership. And then Noel Alexandria Foundation, which helps with families that have had losses. And Birth Injury Center.
I'm
So-
thinking, we usually do a lot of contact of our patients before they come in. I don't see why I couldn't send this out to them as part of our, like, we created a whole little, you've seen it, that little, I forgot what we call it, the little book thing that's got all the resources, but having this as a separate link, I think would be great, or even like creating a QR code
Mhm.
and having it everywhere where they could even, like in the rooms, look at it. 'Cause there's
Yes.
so many great resources right off of this one website.
Thank you so much, Brenda, for bringing that up. That was my next thing. I like, how can we get this out there to our patients? And I love that idea, having a QR code. And I can actually, I have an example, and then maybe we can improve on that and make it our own.
Jasmine, I have a question. Do we
Yes.
have this in Spanish too?
Yes, so the whole website, you just click the icon right here at the right, EN to ES, and it translates the whole website to Spanish.
That's amazing.
And I've gone through it and translated it myself. So if you guys see anything that looks a little funky, let me know and I can correct that.
I'm gonna start adding my coordinator to this call too. Because she's the one who does all the contact with patients, so making sure she's in the loop so we are getting this information to them.
Definitely. And I know right now I don't have I mean, even going through the resources and seeing what I can, if you know of a resource that we can add on this, let me know, give me a list and I can talk to them and see what information they would like for us to present so that they can be added to our website. So like Bernardo, if Current Family Health wants like maybe I can do a landing page for, you know, health insurances, because sometimes
Yeah.
we do run into families that don't know what kind of health insurances are, you know, available here in Kern County.
Yeah, that'd be cool. And if I can send out the flyer, what our new updated incentives are, that'd be pretty cool. We can put it on the website as resources.
Definitely. Also, another thing that I've added is college lactation rooms. I visited the California State University of Bakersfield, CCB, and it was pretty exciting because they have 3 lactation rooms on their campus. And they have this page that goes over how you can go about checking yourself into that room and what resources are available to you as a prenatal and also, you know, postpartum. So that was really neat. I really liked that, and I included that in our website. And then the rest of the stuff, I mean, it's just a little bit about us. This one where is it? I was thinking of making adjustments to this one. So maybe making this with our organizations as well, like members of the coalition, and having like, you know, Current Family Systems, Memorial Hospital, Baby Cafe. And then if you guys would like, I can also do individual, you know, what's it called, like Janet and myself and Jenica, also include you guys and have a photo of yourself and your title and just kind of add that to it. I don't know if that's something that we'd be open to.
It's a great picture. That is beautiful.
Thank you. And Janet, I told her, Janet, I need to get a photo of you because I've been trying to get a photo of you for so long. And she's like, well, take one right now because I have my makeup done. I'm ready to
It's
go.
a good one, yes. It looks really good.
Yes. And I'm like, Janet, you're just effortlessly gorgeous. I love it. And then our events. So our National Breastfeeding Month. So for those of you that weren't able to attend or didn't get to see the photos, so you can learn a little bit about who was there. Imelda, you had mentioned Black Infant Health and POP.
Yeah, there's my team there.
Exactly. Yeah, so it was so great. And that was our display for the month of August. And these are the two gals that helped us give us the opportunity to host them there at the Beale Library. And then organizations that were there as well, Nurse Family Partnership. And there you are, Miss Brenda, and I can't remember.
Cami, her name is
Cami, yes. They were giving out these neat little, they were like kits, like with bandages and just kind of like a safety, like a first aid kit. It was really, really neat. Yeah, so that's our website. And let me go ahead and show you now our Instagram. We recently had a giveaway. And we gave away a basically a, what's it called? A little basket for a baby bundle basket with a baby blanket and items non-related to breastfeeding. It was like a little storybook, a blanket, a swaddle blanket, and those little washcloth blankets, for the burping blankets, burping
burp rag.
there you go. So those were in the basket, and we actually went up in 50 followers. So there was a lot of great exposure because of that. I think I have a post on that. Okay, so I think I just posted, this was the giveaway post, and I was also giving them out at healthcare, at clinics, and at events that I was at. And I thought I had a picture of the basket itself, but no. So we did go up. We started off, when I first started, we started off at 84 followers. Now we're up to 314. So that's pretty exciting. And a lot of the followers are organizations here in the community, and they are so great about sharing our post and letting the community know that we're here and we're here to help and we have resources. So I just wanted to give you guys that update. Any questions, comments, concerns?
Really good, amazing.
And if you guys ever have any ideas for posts, or if you know of an event and you guys want me to share it, let me know and I can put it up. Makes my job a lot easier too. Other than that, so going back to the Kern County Breastfeeding Coalition resource guide. So when I went into my role as an RBL, I wasn't aware of how this actually, I know that my duty was to update it with the resources, but as far as how it came about, if there's anybody here on the call that knows how it kind of, the inception of it started, if you can please let me know how we can go about, changing it up, like what's a better way to give out provide resources on that resource guide, and I'll show you what I'm talking about. Because I know when Catherine Ocampos, she had come up with a resource guide, and then she changed up her theme And the one that I had was very different than the one that they were giving out at another hospital. Here, let me see if I can. This is what I mean. Can you guys see my screen? Yes?
Yes.
Okay.
Yes.
So this is the one I created based off the one that I found from, I believe, Adventist Health, which was San Joaquin Hospital, was giving out a resource guide a few years, from back when. I was going off that style. That's why I included the community breastfeeding support, and then free classes, free virtual prenatal birthing series. And I included those hospitals, and then the private lactation consultants, and then the hospitals in Kern County, and then QR codes. But as I've been distributing it, a lot of private lactation consultants have come forward and wanted to be added to this resource guide, which I think that's great. The only thing is, would it be okay for me to make this into like a 2-page resource guide? Or should I just change the formatting altogether and make it more condensed as we get more resources in the community?
I think it's smarter to make it into 2-page front and back, so it's one sheet of paper. And because if you make it too much, maybe I'm not looking at this sizing, but it looks pretty busy already. I think if you try to make it smaller, again, I don't know how.
So actually, it means we are advertising for the private lactation consultants also, right?
Well, and that's another issue.
Yeah.
But they are resources. So.
And thank you for bringing that up. That was 2 points that I was thinking. Because it's 1 page, it's easy. It's, front and back, and it's easy.
Oh, it is already front and back.
Mhm.
Oh, I'm sorry. I didn't understand.
No worries. It's a front and back page, and it has QR codes that go over some highly requested resources. So I included the car seat passenger safety program, that you may receive a car seat if you complete that course. And then 211, postpartum, grief share, mother's milk, mother to baby, which is the exposures during pregnancy and breastfeeding. But I was thinking, and this is something I mentioned to Janet, we were talking about the private lactation consultants, because I know that there are already a few websites, like the United States Lactation tell me, Leslie, is it
USLCA.
Yes, USLCA. So they have a directory where you can find the nearest IBCLC to you.
Mhm.
If that is something that we all agree on that would work, then I can add a QR code for private lactation consultants. They can scan it and then go about looking for the nearest ABCLC or lactation consultant in their area.
Well, but also if you're thinking that you don't want to have people that charge on your list, you would just want to have, then there's other people you need to take off of there also.
Yeah, no, for sure.
It just depends on what is our focus. Are we looking for resources that are available, and some of them you have to pay for and some of them you don't? Or are we wanting to only list people or agencies or whatever programs that are not a charge? And if you want to find someone who is going to charge, you have to look further, which, again, we sure can do that. And that is a way to take away advertising for people that charge. But again, there's other things you'd have to change there too if you didn't
Right, and so when I mentioned maybe changing the format of this resource guide, this is one developed by an RBL in the San Bernardino County area or Inland Empire. And so their breastfeeding resources guide, she made it, right now it's cut off, but these the top line, can you guys see my screen?
Yeah.
Yes.
Okay, perfect. They have breastfeeding support line, they have a breastfeeding clinic, in home visits, and then they have a fee-based icon. So if you look through the resources, she separates it by city or by region. And they have certain ones with a little money sign by it, and that shows that they are, fees are part of the service. Or fee, yeah.
I kind of like this their layout in the
Mhm.
sense that it's just easier to the eye.
Yes,
And it's easier to, like, let's say finding the city. For us, it's not that many cities, but here it's just easier to find the city you're looking for, and then the little money icon, easier to identify. Is there a fee, right? 'Cause I think that's everyone's question. And the hours operation, and then phone number. Because the one it looks like the one we have right now, everything's kind of condensed, so it might be a little bit difficult for a reader to identify resources. That's my take on this.
I prefer this one as well, the inland. But we also have to take in consideration that this has to be bilingual. So you're gonna have to squeeze the Spanish right below the English, or figure out, or one page English and the other side Spanish. I don't think we have as many resources as they do in the inland. So maybe that's going to be a little bit easier for us. As far as, advertising for the private who charge a fee, it's free advertisement for them. So I don't know. I was thinking more of like, maybe we just direct them to that web page that you were saying, where if they want to look for other resources, then they could go directly to that. It seems like we're promoting them, and there might be others who probably say, why aren't you promoting me? So I don't know if there's, like you mentioned earlier, another state web page that they can go into and look up those resources where they can get those either free or the type of services that they want. Maybe just a link to that.
Well, the USLCA one, that's United States Lactation Consultants Association, and they do have the service that you can go to the website, but it doesn't, I don't believe it has, like, Baby Cafe or WIC on it. I believe it's
No, it
just
doesn't.
IBCLCs.
So I would definitely leave Baby Cafe in the Wix, the local ones that we work with, especially they're part of this coalition, definitely. But again, all those others, it's totally up to you. But we're promoting them, unless they want to be part of our directory, and we want to say, hey, in order to be on a directory or have your logo, there's a fee.
Yeah.
And then you could pay for your web page. So I mean, that was my only concern. If there's a link where people can actually link onto, and we just put the link for other services, or anyways, that's just my 2 cents.
Yeah, no, I agree with Imelda that if we switch it to something like this, I think we can put more, condense those 2 pages we currently have into 1 page, and then back and forth, one side Spanish, one side English.
definitely. Yeah, no, I agree. When I saw this, I immediately was like, let me bring it back to our coalition, because I feel like you said, it's easy on the eyes, and you can see, what is it that you're specifically looking for, and is there a fee? As far as, so what I'll do is I'll start off with the free first, everything, all the, Baby Cafe, WIC, all the organizations that are free, and then the ones that are for charge. I mean, because of this page, I mean, we can always put it on our website. What do you guys think?
Yeah, and that would actually force people to go to the website, like us on the website. So if we put it on this piece of paper, it'll force them to go into our website and look at others, other stuff that we're providing, more educational stuff.
You could do both. I mean, you could put the USLCA referral on this page, and then also you could say, check out our website for more information. And as Imelda, was it Imelda that said that? Sorry. You know, they would get a lot more information also because of all the videos and information that you've put on the website. And so definitely, at least the website should be here somewhere so that people can look at that. And the way you have La Leche League International and all that kind of stuff, that definitely should be on here also.
Definitely.
Anyway, and I think it's great to have it in English and Spanish also, because that's definitely a need.
Any other thoughts? I think these are great, and I will draft one out. I'll show it to you guys, and if you guys give me the go ahead, then I'll start distributing the new breastfeeding resource guide. Since this one's already state approved. Because, well, I know that sounds weird, but so anything that I develop with the coalition, I can just distribute that. But like if it's something like this, she actually developed it through the county, through her county. So she had to go through State WIC, CDPH to get it approved and all that. But since it's already approved, I can use it and we can distribute this here in our Kern County,
Well, and I
So-
think to have something that's approved by WIC is important thing. I mean, you know, that just a little bit more oversight.
Mhm.
When you say approved by WIC, you mean the San Bernardino County resource guide, or, but it has a lot of the cities that they're not our cities. Does it have Bakersfield in there?
Oh, no.
No,
Sorry.
Okay.
it was- yeah, I think it was
This is
county.
her resource.
That's their resource. So which one
Yes.
are you referring to? The pink one, the one that you developed?
Yeah, so that one, we're gonna, I'm gonna take that information and put it into a format like this.
Oh, okay. Is that what
that
you're
we're
saying?
looking at.
Just
Mhm.
since the format's already been approved, that's what you're gonna
Yeah.
do is kind of, okay. I didn't get it. I thought maybe,
No.
sorry. Thank you. It's
No,
the
no worries.
formatting. Thank you.
And I'm seeing here in this flyer, it has the that it got sent out by the public health department. So is that something we should partner up with the public health department and they have a webpage as well?
Yes, I think that would be a great thing, because so like, the reason why this one particularly is from the public health department is because in San Bernardino County, the WIC agency is part of the San Bernardino public health.
Yeah, most
Department.
counties are like that except for ours.
Well,
I know.
LA
When I
County's
came
the
out here,
same
I got
way.
so confused. I was like, what?
Right.
There's two WICs?
and
I'm used
then
to a WIC.
yeah, and then well, it's kind of tricky. So that's just one of the WIC agencies. So then there's WIC agencies that are partnered up with like community clinics like Clinica Sierra Vista, and then nonprofits like CAP-K WIC. Does that make so that in LA County, there's not just one WIC, there's 7 WICs agencies. In San Bernardino, there's 16 or 7 or 16. I remember she
wow.
gave me a big number. So she oversees all those WIC agencies. I only oversee 2. So we have Clinic and CAP-K. But I think it'd be great since we're right now, we're not under their umbrella. I think, Imelda, if you could help us out in that format, like distribute this with your organization and have them include this in their website. Because I know that their website, it needs a little bit of a updated information. Some of the stuff.
Well, we'll have Bernardo, since his wife works here at the health
Oh.
department, and she's a lot higher position than I am and has a say so. She works closely with our director. So Bernardo, you're going to be tasked with that.
I know.
Oh,
Okay.
I was
enough.
gonna offset it to the marketing team. I was like, where's I forgot her name. I was like marketing public
Michelle
health.
Corson.
Yeah.
Yeah, but no, definitely. I mean, Bernardo, you want to mention to Jasmine and
Hmm.
she can bring it up to Michelle. I think that would be great. If we could actually post it on our webpage. And the other thing is Cap Gay, they're 211. I mean, they definitely need this information. So we also need to push 211.
Mhm,
Hmm.
definitely.
Yeah,
Um,
is this do we send this flyer? Do we know if this flyer ever have been sent to 211?
this flyer, they do, so 211 just went under a administration change.
Hmm.
But one of the gals that does the outreach, I provided her with a digital version of the English and Spanish breastfeeding resource guide. And she let me know that she would distribute that amongst, at events. But as far as being on the website, that's something that hasn't been established. So maybe I can reach out to our outreach coordinator and see if that can be, also a resource on there. The only thing is, because a resource guide, it always changes, whether the business or the organization is no longer, like, the number changes or the location changes or X, Y, and Z. I was thinking of maybe just providing them with like a link to the website or like so that the website is something that can be easily changed and, checked in right then and there. And a resource guide, you kind of have to call the numbers and you know what I mean?
But I think, if you had both of them, that would be good, because some people are going to be digital and check the website and all that kind of stuff. And others of us that are not as good at that would appreciate a piece of paper in our hand. And so if you had your website on this resource guide, and then people who wanted to go that way, they could, and people who do better not looking at a monitor and do better looking at the printed page would have that access also. And I personally think, I don't know, when I'm looking at a printed page, I always assume that it might not be updated, it might not be the latest, but it gives me the information of where I can find the latest. And so I would say go both ways and have it, a QR code or whatever that they can go to the website, and also something that you can hand people and
Okay.
that you can mail out, and you could of course digitally mail it. And if they
Yeah.
didn't want to print it out to give to people, then okay, it's not a problem. And I just want to say, Imelda, to you, that I really feel strongly that the public health department, which is what I used to call it when I worked there, needs to be much more involved in breastfeeding and breastfeeding education and support. And personally, I would love to be involved in making that connection. I had a couple projects in the last 2 years, and it didn't happen that we got connected. And so I think that, to me, public health is the exactly appropriate place to push breastfeeding, because it has such an effect on the health of the public and the health of the community. And it's just hugely, hugely important that the health department should be right out there in it.
I totally agree. Have you ever met with Fila Bautista?
I have, actually, and I've also talked to Michelle Corson, and there was a project that Baby Cafe Bakersfield and Central Valley Lactation Association was working on, and we really just didn't get I was very disappointed that we didn't get a ton of support from the the public, what's it called now? It's not the health department.
Public health department.
Health services or whatever
Oh,
it is.
Kern County Public Health Services.
Yeah.
Yes.
Yeah, but I think that they recently they're rebranding their name, because that was always an issue.
Yeah. And so at any rate, I just really feel I would back you in whatever you can do to bring breastfeeding awareness more strongly into the health department,
Well,
into the
I
public
think
health services
Jasmine,
department.
probably on your next agenda item, invite Michelle Corson or, somebody, Jasmine Ochoa, and bring them, put them on the agenda, and just get a meeting together. I definitely think it has, everything for health department. I mean, it's the health department. Our community, healthier communities. What can we do?
Absolutely,
And we do all the
absolutely.
education. So we're here. We're at it already. So why not incorporate that? Jasmine, I was going to ask you, do you have a list of OBGYNs in town that you can distribute the resource guide that you just put together, the resources?
Yeah, so I actually went on the current family systems and the I can't remember the other health insurance,
Health
health net, yes,
Health
health net. I went down their OB's offices and I've been making my rounds. The only so I've been also making my rounds with Clinica Sierra Vista, and I am waiting for Omni to give me the go ahead and to be able to connect with their OBs and pediatrics.
I was going to say pediatricians too, definitely.
And is Eileen, not Eileen, Elaine Anthony still over
No,
maternal
she's not.
MCH?
Fila
Oh, it's Fila?
Bautista is. Yeah, she's in
Okay.
field nursing. But Bernardo with Current Family Health, they often have their newsletter that goes to the providers and to the families. I mean, you could put a little article there, or you could even put the resource there, or put the links in there. So I mean, that's a great resource. Most of our members are Current Family Healthcare, so definitely get around.
And thank you, Bernardo, for sharing this link right now. It was to the Kern County Public Health
Yeah, 'cause that's the
breastfeeding.
that's the breastfeeding information and assistance page they have. So maybe that's what I was thinking, partnering up with the MCAH at the public health department to see if one is the list still updated. Is it correct? They said it's 2019. But
It's
maybe
probably under MCAH. We usually
Mhm.
have a resource, link in there. If you, if you
Mhm.
go into that section, we have our own resource book. I know that the health department right now is collecting resources, and we're going to have one resource manual for the whole department instead of just having the maternal child health. But that would be a great start. But we can even maternal child health, they update this. Obviously, it hasn't been updated to since 2017.
Yeah, I was looking.
Maybe we can update the information with the information that you have, Jasmine, which is most current, because this is probably outdated, as Leslie said. I look at a list and realize that it's probably not up to date, but yours is the most current. So definitely with Michelle Corson, you can point it out and say, hey, this is outdated. Is there any way that you can update it with, here's the information, and give it to the maternal child health and let them update the resources and put them on the webpage?
Perfect.
Jasmine, can you go up? I want to see what was on the top.
And how do you spell Michelle's last name?
Corson. And you could always call the 321-3000 and ask for Michelle Corson. They'll connect you directly to her, and they can even give you her direct number, extension, and her email.
Perfect.
Yeah,
So-
anybody at the health department, including our director. She's very open to ideas. So yeah, please feel free to do that. If not, like I said, either myself or Bernardo, we can connect you with people at the health department.
Yeah.
Perfect.
Yeah.
The phone number for HealthNet, which says breastfeeding and nutrition support. So is this like a 24-hour service, or do we know? Does anybody know about that?
Yeah, it does say breastfeeding and nutrition support.
Yeah, so like we don't have this number on our resource, right, Jasmine?
No, and the reason why I haven't
I mean,
added
like,
any of these resources is because I wanted to see if they were first, updated,
working.
working.
Yeah.
So I can definitely call and see
Yeah,
if
because
this is
Yeah, because it will be good to know if this is like a live person, or they just take numbers, or some automated system referring to another website or another place, you know.
Bernardo, on the top of your head, or maybe like you have to check in with somebody, but are these two numbers, would you say for Kern Family Healthcare, are they accurate?
The first one, yes.
Okay.
The second one, I personally will say we will like to take it off
Okay,
because we're trying to just have one number for the whole organization. The second number is for the health education department, but and that's what I'm trying to figure out. I'm like, where's this number going to?
So I did call the health net one. It's just a general health education line.
was it automated or was it,
It's automated. I mean, it's like press 1 if you want to, but it's just a health education line.
Yeah, so the second one for us, it still ends up going back to the queue. So it's better to just remove whoever's in
Go-
charge of it.
go with the 800?
Yeah, it's just a 1-800 number.
Okay. Perfect.
Yeah, then maybe Fila has an HE that can go down this list and really just double check if these services are still available. All these organizations, and then we can make sure it aligns with whatever we have.
Mhm.
Or just give her what you have. I mean, it's already updated
Yeah.
and you have just about everything here, right?
Mhm. And yes.
And more.
And more. So then I will draft that out, and then hopefully by our next meeting, I'll be able to show it. And we can make any adjustments if needed. But other than that, that's it for me. If you guys have any, I know we have 30 more, like little less than 30 minutes. So if you guys want to do roundtable or any announcements, or
Did you want to talk about the bylaws?
we actually already finalized the bylaws that day that you and I and Janet got together.
Yeah, I mean, I
but-
was just wondering if you wanted to like send them out or something.
Oh,
They're
yeah.
done.
I can include them in the email that I'll be sending out with the California Breastfeeding Co-Summit. But these are, it still says draft, but yeah, they're final. We just made some grammatical changes and then merged instead of having a chairperson, have 2 co-chairs, secretary, and then treasurer. But I know as of right now, we don't have money, so it's treasurer really, it's not an active position. But yes, I will send these out and in the email.
And we probably ought to have a signature page or something on them.
Leslie wants to sign her life away. I guess it's something that, the coalition needs to agree upon and maybe sign it.
Well, we need to make them official, and they're probably not official till they're signed.
Oh,
People look at them and say, yeah, they agree with everything, and then we can send them back and say, okay, electronically they're signed now or something. But they definitely should have a date that they're revised at this date, and somewhere.
I think
At least
Janet has that.
Your 2 co-chairs and your secretary treasurer should sign them.
I wonder, Janet, can you hear this? If not, I can just email her later about that.
Because that's a big deal. That's cool that we got them done. I mean,
Mhm.
so everybody should see them, everyone who's on the calls. And I'll start with roundtable updates. I just want to let you all know that we had 25 people at Baby Cafe in an hour and a half, 9 moms, 9 babies. It was crazy. Thank goodness yesterday, yeah, wasn't as crazy, but 2 weeks ago, when it was over, we just sat and looked at each other and went, wow, that was a lot of moms and a lot of babies for an hour and a half, because nobody came in till noon.
So what do you attribute that to? Just,
We've been getting, our numbers have been getting bigger just about every week. Sometimes they, stabilize for a week or two, but we also hadn't had Baby Cafe the week before because the library was closed. And the weather wasn't too bad last week. I think yesterday we didn't have as many just because it was so rainy. But yeah, we're getting bigger all the time, and we
That's
really
amazing.
we need more staff and more space.
How much staff do you have?
Two. We have 3 actually. A aspiring IBCLC who is going to start to take the classes and get her hours there at Baby Cafe to take the exam. She is wonderful because she organizes everybody, and she has everybody sign in and fill out the forms that have to happen, and she gets them like numbered, so Mary and I know who is next. but 9 moms and 9 babies, that was a lot.
I think that's incredible. And Leslie,
Awesome.
I have a quick question.
Yeah.
You know how you guys have that intake, that you have the moms go on the laptop and sign themselves in, and
Right.
is there a section where they can say who referred them to you guys?
I don't know that. We asked that on our Connect form on the website, but the moms that just come into the Bill Library, I have to admit to you that I have never actually filled out one of those intake forms, so I don't know if it. I would guess that it would, because that's something that Baby Cafe USA looks at. So I would guess that it's there, and I can sure, fill one out and see. But sometimes we ask them. But I'll bet you that the form asks that.
Okay, because I remember, sorry.
Go ahead. No, that's fine.
Oh, my sister, she had gone to Baby Cafe. I think it was a little bit before National Breastfeeding Month. And when she filled it out, there was a section that asked her about WIC and was she enrolled? And so I was wondering, is that something that we can also get those, like that data to see if they're.
Yeah, I don't know about that. Let me write it down.
Because I think, Priya, that would be helpful to us to know that the moms are, getting breastfeeding support. And if they go to you first and then come to us, because I know that sometimes between you and I, you refer me some
right. People
participants.
Yeah.
And then what days are they going? Are they going on the weekend more, or or the weekdays when we are open? So yeah, I think that data could help us.
Yeah, that just the in-person is sort of a small part of the people that we help, because we have a voicemail and text, Google Voice, and so we talk to a lot of people, every day, who don't come to in-person Baby Cafe Bakersfield. And then we also still have the Connect form. So we see people sort of 3 ways. And Google Voice, they can leave a message, and then we text back and forth, or we call back, or we do a virtual visit with them. And so we see a lot more people than just the people that come to in-person Baby Cafe. But the in-person is better, I think, because you can see the baby, and you can do an oral assessment, and you can, see how the baby is latching, where virtually, you can see it if somebody else is there and holding the camera or the phone or whatever. But it's not, it's good for people who aren't going to come in, I mean, virtual is better than nothing, but in person is, and you know, they bond together too. You know, they talk among themselves while they're waiting for us to get to them. And so there's a lot of mom to mom support too, or parent to parent support. Sorry, trying to remember my
I don't
words.
know about you guys, but I would be interested if they're part of HealthNet family, or Kern Family Health. You know, I know that they usually have incentives to try to get people to breastfeed. You know, like there's $25 if they get certain things. He's not listening. You know, so it would be interesting to find out if they're HealthNet or Current Health Systems, to see how many
Yeah.
of their members are actually going there, and you know, if there's not enough of the members, you know, maybe there could be an incentive to encourage them to go get some education on breastfeeding. There you go, Bernardo. Thank you.
I know. I was like, I heard money.
We also have our virtual class session on Wednesday also. And truthfully, I think that one works well for moms and pregnant ladies, because it really is nice to have a couple people on there to talk to people that are pregnant about what they should be doing now. What should they be thinking of now? What are the things they want to be thinking of doing in the first couple days and whatnot? And so that's another way. And I don't know, I'll have to check about because the information that goes to Baby Cafe USA, it says on it that it's private and confidential. So I don't know that we could, I don't know. I'd have to check. Let me ask and see what I can find out. I don't know that we would be able to just automatically tell people. I think that because it's confidential. But we sure could ask the people that come in. I mean, we could ask them
You
out
could have
loud,
some
you know,
paper or some
so,
form.
you know, is there a way that we could, is it okay with you if we let your insurance company know that you came, you know, or something like that, or who referred you? I would think that wouldn't be a problem, but I know to get the information off of Baby Cafe USA, that form says that it's confident. What they're, you know, the information that they're putting in is confidential. And they are contacted by Baby Cafe USA 6 months out to see if they're still breastfeeding, and, you know, their input on whether going to Baby Cafe Bakersfield, for example, was helpful to them to extend their breastfeeding time. So they are contacted again by Baby Cafe USA. But I sure can ask about all that and find out.
Yeah, that'd be awesome, because that way it's like full circle. We're ongoing support from your insurance, from WIC, if applicable. Yeah. One more
So-
thing though. Oh, go ahead, Bernardo.
Oh, I was gonna say, Leslie, so you're considering, like, us as a health plan to find ways to incentivize members that are breastfeeding. For example, if they attend a breastfeeding class and actively say they are breastfeeding, then provide them an incentive.
That was my idea, but
Oh, okay.
Oh, I
Jasmine,
was
go
going to say
ahead.
no.
That was I was
was
plugging in the
Melda.
idea for Jasmine, but I think but that's up to you guys. I'm just planting the seed.
Yeah, no, because I did put in the chat box a little bit earlier the different incentives we do have. And for us as a health plan, we have to, it has to be measurable, right? And it's something that the state requires us to do, or if we are doing for example, if we're doing a breastfeeding class, and then the participants that came and learned about breastfeeding, and then we provided incentives for that, then yeah, we can. But it's something we can, work on, develop a plan. But just to provide incentives for just breastfeeding, we have to correlate it to some type of measure that the state requires us to measure, and then that's something we can incentivize with gift cards.
I know that at Kaiser we used to give them a onesie that said that they were a Kaiser, or they were breastfed, but they were a breastfed baby or something like that. But that didn't last for very long because, ooh, how do you know whether they were really breastfeeding? Or came in
They're
and
just
said,
letting
yeah,
them-
I'm breastfeeding my baby. And you're like, oh, really? What are their, their stools look like that? I'm breastfeeding?
Duh. Yeah, we used to
So,
have we used to give out the onesies as well, but I believe the Breastfeeding Coalition and the La Leche League didn't approve of the logo that we had. It
Oh.
was a baby that was drinking a bottle. And
Oh, yeah.
so they were like, no.
Yeah, well, that one can understand that.
Yeah.
But it is hard. It's hard, it's kind of hard to, you want them to breastfeed, of course, but, whether it's crossing the line to give them something because they're breastfeeding, and then
Yeah.
but the people who tried to breastfeed, but they were not able to, they're upset
Yeah.
because you're segregating them. You're like,
And moreover, like it's for the betterment of their health. So there should not be an incentive to do it. It should come from within,
yeah, but wouldn't you love that if everything was
Yeah,
altruistic like
exactly. I mean,
that?
same thing. We have the same issue at WIC, I mean, we don't get the budget to give out incentives. I wish we could, because some studies do say that incentives help, but some studies do say that it's the education that helps. So, like it's a in between thing, like do people actually do things with incentives, or they just say it, or does, of course, the education at different stages of their pregnancy that helps in better outcomes, so
Yeah, it's a challenge.
it is a challenge. But I think things are changing. Definitely more people are, especially when we had the formula shortage, we saw like a lot of moms going from not breastfeeding at all to mostly breastfeeding, and some breastfeeding to exclusive breastfeeding because they could not deal with the shortage of formula anymore.
Yeah.
So I think sometimes I feel that maybe this privilege of getting the formula doesn't let them, try or keep going with the breastfeeding challenges that they face, They feel, of course, there's an easy fix, just
Yeah.
get the formula and give it to them. But formula shortage did make a big change. We had our breastfeeding numbers increased at WIC.
Yeah.
Yeah, I heard, right? It was like normally like
Yeah.
8 or 9%, and then it went up to like
Right.
past 10%. So it was a big jump.
And we were hearing from staff all the time that, moms are calling. They want to just, know how to increase their breast milk, There's some breastfeeding, and now they're mostly breastfeeding because they're breastfeeding more, don't need the formula that much. So there was definitely this brought a change, and hopefully that change sustains and gets passed from one person to another, that what they faced, and maybe people remember that there was a shortage of formula and what a nightmare it was,
Yeah. Food security,
Yeah, exactly.
another public health issue.
And something that I wanted to comment, I know that a lot of my work is kind of in the shadows, you could say. I don't really publicize it as much, but I have been trying to reach. I just had a meeting with the Kern County High School District, Kern High School District, and so with their community specialists. And so they're working with the families. And something that was really amazing to me is that Miramonte High School, they, after talking to the community specialist, I told her about like how important lactation accommodation is. And even though, she started opening up to me about her, she had 2 students that were pregnant. And she shared with me after our conversation, she talked to administration, talked to the nurse, the school nurse, and they actually made a room only for nursing moms, and then they have another room for staff. So that kind of was the catalyst that something that she it kind of triggered that, but it's not as publicly known, because you think, well,
They
we
would
wanna-
think on
we-
their own.
Yeah, or like teen moms, you know, I know it's something that a lot of people feel uncomfortable talking about it, but it's like if there's no support for them, then how are they gonna
Yeah.
be able to, you know, be healthy and help their family also be healthy in the long run? And so I just
Well,
want
and
to
I
share
don't
that
know
win.
if Clinica still does the Adolescent Family Life Program. I mean, you know, but that's something that, you know, maybe we should be talking and trying to get someone from there involved in talking about breastfeeding, and can we be a resource for those teens? Because, you know, usually, you know, statistically speaking, teens are great at having great supplies and breast, you know, milk supplies, and to just, you know, be able to interact with them, you know, like the nurse family partnership. And I know that they're very strong and encourage, you know, breastfeeding. And that's, to me, that's the place that we're going to make a change, I think, is one-on-one. You know, it's important to have the coalition and talking and the groups together and stuff like that. But where the rubber hits the road is when you start talking to individuals and say, okay, this is your individual, I'm customizing this plan to you so that you're able to breastfeed. So let's talk about what's getting in the way and how can I help you, you know, turn that stumbling block into a stepping stone. And I think that's, you know, that might be something that we want to look at reaching out to, is Adolescent Family Life, and that to be resources even for the staff to be able to help, you know, more teens, you know, just for the birth control alone of breastfeeding.
They definitely need to part of this coalition. I mean, you
Yeah,
need to get them on board here.
you know, because again, the more people that you can get to successfully breastfeed, the more people that they're going to reach out and touch also, because they were able to breastfeed. And so then they can say, you know, no, you can do this. And that's, to me, I always think about in the United States, that we don't have enough people in the United States that have successfully breastfed to be able to say we're a breastfeeding country. We're not a breastfeeding country. We are a formula country. Because we're a bunch of capitalists? I don't know. I mean, you know, what, why is it that, you know,
Convenience.
the formula companies have a lot of money and they can do
yeah.
all sorts of, you know, sneaky, devious misinformation. And what we need to do is every single person needs to say to the next person, you can do it. You know what? I went to Baby Cafe, or I went to the Nesting Company, or I went to Adolescent Family Life. I went to WIC. WIC helped me. You can do it also. The health department. Sorry, Imelda, I keep talking about the health department. You know, community health is hugely important. Hugely important. You would think that the insurance companies would be pouring money into our coffers because we're saving them so much money in the future if we can get moms to breastfeed.
Oh, definitely.
You know,
There has to be, you know, studies, right? And we have
there are
to.
studies, though.
There are lots of studies. Yeah.
That show that.
Yeah.
There are studies, but it's just, you know what? When people go to the pediatrician and the pediatrician tells them, you know what, you shouldn't even try to breastfeed. You're having troubles breastfeeding. Just give the baby formula. Don't even try to give the baby some formula and some breast milk. They came in and told me that. And I said, what? Oh, well, you can't mix them. You know, you can't mix breast milk and formula in a baby.
Yeah.
Who taught you that?
Must
Well,
be an
you
old, it must be an old guy like me, you know, back in my day, that's what they used to tell you. So
I
he
mean,
used to have those doctors around.
yeah.
And you need
you
to
know,
let me
formula
know
companies-
what offices are saying that. So not that I'm gonna go in with guns blazing or anything like that. I'm not
Well,
gonna
but
go
that's what
in.
we should be doing. We should be going,
But
what the heck are you guys thinking? Or even if that's what you think, let's chat and talk about. Or could you, if someone comes in and says they're having breastfeeding problems, say, go to Baby Cafe or go to WIC, or, you know, don't talk about stuff that you don't know about. Don't, you know, tell somebody. I had a doctor who the mother didn't even have thrush. The baby didn't have thrush, the mom didn't have, and her doctor said, you know, you're going to have to throw away all that frozen breast milk that you have because it's contaminated. She threw away like weeks
Milk.
of
Oh,
frozen
gosh.
breast milk. You know, it's just the information that's out there just is so, it's just discouraging.
Yeah.
And that's why we have to look at one person at a time, because at least one person at a time, you can feel you made a little bit of a difference.
Yeah, and their word makes a big difference because,
Oh, they listen to their
yeah,
doctors. They
exactly.
listen about that. They don't listen about other stuff that you wish they would listen to their doctor.
No, that we have this struggle all the time, especially
Yeah.
with babies losing weight, which is even less than 5%, you know.
Yeah.
And then babies with jaundice, which is also like sometimes borderline, and it's
Yeah.
just done forever that, oh,
Yeah.
you cannot breastfeed because your breast milk is giving jaundice, you know, all that.
Yeah.
We struggle with that a
Yeah, so
lot.
that's another area that we need to, you know, think about how can we interface with, and that's why I think sometimes, you know, again, to go back to the health department, to say, you know, this is something that it's not just Baby Cafe Bakersfield that's saying this. It's not just WIC that's saying this. It's not just, but everybody, the coalition as a whole is saying, let's.
We don't even have a single billboard on breastfeeding, you know, like
Yeah, or just, you know, can we?
on women's health, I don't see much of the billboards either.
Yeah, well, maybe
You
it's
know,
because
like,
we're
Yeah,
women.
I think we have to take it a little bit higher to like to the state level where it incentivizes the health plans like ourselves, that
Mhm.
if we get directions from the state, then that's when we start making changes at the ground level. So maybe that's something we maybe
Yeah,
start
maybe we need
working.
to look at who we need to talk to say, let's start it at the state. But, you know, that's the summit, maybe. I mean, the summit is having the same, and, you know, I can't think of the initials, but the United States, the USBC, that's what it is. The United States Breastfeeding Coalition also, you know, it just is like, there's all the experts and people are just going, oh, well, you're just not right. It's not right. That's not right. That can't be right. You know,
yeah,
you're just
even public health departments, if they have a staff member who is really an advocate on breastfeeding, they can also make a big difference.
yeah.
Like the local public health departments, they don't have to follow like a set guidelines which are followed in other counties. They can have their own stuff, but it all depends upon a person who is there, who is
No.
making, yeah, if that
Well,
person is
we have
advocating.
Ashley Acevedo is very proactive. I'm
Yeah,
sure you've all met her. She's great.
Yeah, she
But
is
you know, but you
actually,
have to understand, Priya, that we're only the peons here. You
Yeah.
know, we could suggest, but it's going to take the community, the public, to really push that, whether it's speaking to our director, whether it's going to the board of supervisors. You know, they're our bosses. If anything's going to get done, they're going to force it on us. But we definitely, public health should be taking the lead. It is a public health issue. So,
yeah.
you know, we
Yeah,
have
it
to
is a
have those
public health.
conversations. And you know what? I've always said, you know, go to one of our local legislators.
Yeah.
You know.
So maybe, sorry to cut you off a little bit. I think that's exactly right. And maybe our kind of catalyst in starting this could be like a breastfeeding welcome campaign, you know, with the Kern County
Board of
Breastfeeding Coalition.
Well,
Supervisors.
see,
And
and I
then-
think that's something when we talk about the cling things, is that what you're saying? The breastfeeding is welcome here?
Mhm.
Yeah, and
The-
so we should talk to the Board of Supervisors. We should talk to
Yeah.
those people to say, we're going to do this because breastfeeding is really important. And then during World Breastfeeding Week, World Breastfeeding Week and National Breastfeeding Month, that's when we should go to the Board of Supervisors and say, we want a proclamation made for breastfeeding in Kern County. And this is what we've already done. We already have done the welcome breastfeeding in, you know, and so it shouldn't be something that we're just doing. We need to ask permission to say, buy into this. Breastfeeding is important. And look, the health department agrees with us. Kern Family Health agrees with us. WIC agrees with us. There's all these people that are in agreement that we need to do this, and we need to become a breastfeeding nation and not a formula nation.
Definitely.
Actually,
County. Let's
the
start in the
state,
county.
Yeah, the state used to provide us the breastfeeding proclamations, and we would go to the Board of Supervisors during the World Breastfeeding Week and present it there. We
Yeah,
have done that in the past.
well, and the board can give you, the Board of
And they
Supervisors
would,
can give you a
yeah, and
proclamation also.
yes, and
And
based
we
on
can-
that, they gave the proclamation that they
Yeah.
declare whatever, you know, the.
And we can
national
go
breast-
to, Karen Go and in the city and get a proclamation from the city of Bakersfield. This is all stuff that the nurse practitioners do. We, to go to say, hey, here we are, we're working hard and we're an important member of the healthcare team. And breastfeeding is an important community activity for the
Yeah.
community, the health of the community. Yeah, I let's do it. Let's do it.
Yes,
I'm ready.
I love this. I love
Right.
this energy. Let's continue this. And you know what? Just for time's sake, I know that we're a little past our time, but I'm gonna send out that email with that information with the California Breastfeeding Summit, as well as
The bylaws.
yes, the bylaws.
And
And
then
then
Let's talk about the cling thing in February. Let's talk about
yeah.
doing it. Let's talk about doing it.
for sure. Thank you, Leslie. And then let us know how that how we can start a referral tracking the referrals.
Okay, yeah, I'll ask them. Yeah, I'm not
Awesome.
100% sure about that, but I'll find out.
Okay.
Yeah, because before we used to partner up with Lily Lactation, but it looks like the Lily Lactation has dissolved. So
I don't know, Erin Wells, is she still in town?
She retired from that and she started a new career, I believe, in teaching.
Oh, well,
mhm.
she's breastfeeding. Now she's teaching something else.
Yeah, so maybe Baby Cafe. That's something
Absolutely.
that
Absolutely.
will be our next partner.
There you
Or
go.
the Central Valley Lactation Association also, I mean, this is absolutely what we want to be doing. Absolutely what we want to be doing. So
I love it.
someone's here. Okay,
All right, guys.
Perfect. Thank you,
Have a
y'all. Stay
wonderful
safe.
day.
Thank you.
Stay
Bye.
safe.
see you in
Bye.
February.